pregnancy is a particular period in a woman's life, which starts from conception and ends with childbirth. It is a transformation that lasts from 38 to 42 weeks and is divided into 3 phases. The first trimester from 0 to 12 weeks, the second trimester from 13 to 26 weeks, the third trimester from 27 to 30 weeks. During pregnancy, there are anatomical, metabolic, psychological changes. For example, there is an increase in the cardiac output of about 30%. The growing uterus mechanically alters ventilation as the diaphragm rises by about 4 centimeters, and this leads to a slight increase in oxygen consumption. There are also hormonal changes, especially concerning the relaxin. Relaxin is produced from the second trimester, and it relaxes the ligaments of the pelvis, so it's important not to overstretch in this phase, because not feeling pain could lead expectant mothers to strain the body too much, with negative consequences in the following months. We also have to consider that in pregnancy, the rectus abdominis dilate to make room for the baby, so it is important to do sit-ups in order to maintain a good posture. There are cases in which doing physical activity could be risky, for example in case of high-risk pregnancies. For this reason, an accurate evaluation by the doctor is necessary. He will issue a certificate of fitness for physical activity. Physical activity has many benefits, both emotionally, for example, by preventing and alleviating postpartum depression, and physically, by reducing weight gain and the chances of developing gestational diabetes. Furthermore, joint physical activity between mother and her son or daughter promotes the cognitive development of the baby. The first phase to consider goes from 3 months to 6 months of pregnancy. But depending on the case, the exercises that we propose can also be valid for the first trimester, so from 0 to 3 months. It is important to remember that intense dynamic exercises for the abdominal and pelvic floor muscles should be avoided at this stage, considering the important physical changes for which the woman is preparing. In the second trimester, so from 3 to 6 months, you should focus on strengthening your arms, shoulders, and legs. You also should focus on pelvic floor exercises, postural exercises, mobilization exercises of the lumbar spine. It is important to avoid exercises with legs apart, intense stretching because of the relaxin, that is the hormone I have talked about before, the one that relaxes the ligaments of the pelvis. You also should avoid jumping exercises, and it is strongly advised not to spend more than 5 minutes lying down on the floor.